our own institutions. It's as simple as that. Every other culture have got their own institutions. Their Croatians have been there for 5 minutes. They've got their own community centres, got their own mental health institutions. We just have to put our money into what we want to see in our community. Petitions, quite frankly, don't do anything, to be honest. I think petitions is the new form of lazy activism. You know what I mean? To me, it's lazy. I'm not being trying to be disrespectful, but I'm just saying it how it is. Petitions is lazy activism. We need to put money and time into our own institutions.
But please be lazy and go onto Black Mental Health UK's website and sign our petition. No, I don't mind if you're left this way. No, for us, if you're a campaigner, it's what sometimes it's a statement, because by having a petition, if people sign it, most people hopefully will read what they're signing, and they get the information. I'll go back so that you see it. They get the information that they didn't know before. So, for instance, on our petition, thank you. On our petition against Black deaths in custody, what that's done is it's put the issue of Black deaths in custody, Black deaths in custody, on the political agenda. And we're saying this is on the back of the only debate in Parliament on this issue. And then we're saying that there needs to be independent judicial inquiries into all preventable deaths of people in psychiatric detentions, because when people die in prisons, the prison's ombudsman, a different body, looks and investigates the death. When people die in the police, or whatever people think of the IPCC, a different body investigates. So when somebody dies in mental health services, natural causes, they investigate themselves. So, like, even putting that out there makes people sit up. And you're right, it's lazy, but this information isn't readily available unless you're willing to read reams of documents. And also, just asking for a public inquiry into Black deaths in custody. They might not want that, but you're right, it's lazy, but it puts information out there. It wasn't before, so please go on to www.blackmentalhealth.org.uk to sign the petitions.
If you get some time, stick a donate button on there so it goes straight to your bank account.
We do, but the website, like, the expert opinions are free, the announcements are free, but our news is subscription, so people can read the top bit. So it's not so much an income generator as we've seen people just cut and paste and say, you know, like typos and all, and claim it's theirs kind of thing. So we can drive an agenda through this, and so it's a tool. It's a tool. Yeah, we need to do.
I'm going to so it's a long journey for me.
And so what I was thinking, if you've signed in, would it be okay to get your name and email address?
She's got my details.
I've got it. Fantastic. Yeah, and then we can follow this up.
Do you want to speak?
Yeah, it will be long term rather than short term, but I'm keen to, because this is how things change actually.
I'm the conversation with that nutritional aspect of treatment. And I'm so happy I've come here. So I can lead to people like you to see how we can sort of
we're going to try together, because when I read the David Bennett Inquiry report, I had no idea what I could do, and I'm not doing what I would like to see happen, but if we all do something, we'll make a difference.
Yeah,
Thank you very much.
Thanks for coming.
I was also going to acknowledge the stresses that we as African people, African Caribbean people, do suffer, because we can't negate the influence of racism, and you know that is an added stress and pressure on us, which obviously does cause stress, and that can lead to mental health. So although obviously the statistics are showing that we don't suffer more mental health than other communities, then you know we definitely have more pressure on us. And as you mentioned, Esther, and I think it's Joy DeGroy-Leary, she's written about post-traumatic slave syndrome, and we never have had a reckoning in this country, particularly about the effect of trauma from enslavement and everything else. So as we keep saying, I think alternatives are so necessary to the system, because you know, we need to look at society itself and how this current way of we consume, we isolate ourselves in transport, in commuting and everything, and we don't talk to each other when, you know, in communities, in cities and everything, as much as we should. So the society itself is sick, so that society itself is mentally ill. So should we? How much do we engage in society? How much do we hold up figures, I suppose, who've achieved, the powerless, sorry, the people who have achieved in this capitalist system? I recognise the need to hold them up as examples that we can achieve, but I think examples of people working in the grassroots also should be there, who as positive role models, not necessarily following the capitalist model of achievement, because that can feed into mental health issues in terms of wanting to achieve, because there's so many barriers for us to get down that route, and it's going to cause stress.
No, you're completely right. Thank you. And we are totally open to suggestions. The next edition is being written. Any contributions of our excellent calibre are more than welcome on different perspectives. And it's going to be a hard. This one's hard copy, and it's going to go like with this work. It's learn as you go. It's not. Black Metal Decay is a reaction to, yeah, I think all your points are very well made. Thank you.
Yeah.
Sorry for coming so late, and if I've covered anything that's been said, I apologise. But what I'm interested in is how is mental health perceived in the Black community, first of all? You say that we want support, we want people's donations. Have we done like an honest kind of questionnaire or forum to find out how, is there a stigma behind Black mental health in the community? Do we ostracize our own people? Do we rally together if somebody suffers an ailment? What do we do, honestly? How do we treat those in our community who have mental health issues before we start looking out to others to kind of respond and deal with it? How do we address it?
Thank you. That's a really important question. In all honesty, sorry, it hasn't been raised already. The genesis of Black Mental Health UK was sadly in reaction to finding out about the inhumane treatment of somebody from our community, whose picture I will show you. So the genesis was. That was my introduction. He's the Stephen Lawrence of the mental health world, and so on the back of that, and the fact that the law was changing, Black Mental Decay was formed. And the reason Black Mental Decay was formed, it was in order to be able to articulate the current concerns of this stakeholder group in an arena where everyone wanted to influence how the law was changing. And so the organisation was largely self-funding, and that's been for a number of years, but that's fine. It's now growing and learning how to get resources from charitable funds and stuff. And so an audit has never been done. There's a national program at the moment looking at stigma, because it's a huge issue. And you're right. How do we perceive it in our own communities? Because addressing stigma is one thing, but it's a bit like how do we perceive cancer? How do we perceive diabetes? How do we perceive coronary heart disease? How do we perceive heart attacks? When an English person is having a heart attack, regardless of how the family feel about the person or the fact that they're physically unwell, you expect the highest standard of care for your loved one, particularly when you have paid every single month through your national insurance for their treatment. And so when our communities go into any system, we do not expect them to come out in body bags, regardless of whether there's an auntie who thinks, I heard you see, you shouldn't have married that man, I told you. Who cares? Like a human being, because my DH data shows 1 in 4 will be affected by this issue within our lifetime. So it can be anything from mild depression to full-blown schizophrenia. So it's a very good question, and maybe it needs an answer, but given the numbers of preventable fatalities that are happening in the system from one group, our priority, because of the energies and resources, will always be on preventing this, but it's a very important thing.
Yeah, I'd like to add something to your question. Your question was about how do we deal with our own people, our own family. The first thing we need to stop doing is living in denial that there is mental health in our families or even within ourselves. We have to face up to it as families, as friends, because a lot of us just live in denial. It's a shame. It's still taboo to talk about mental health in our community. You know, it's still a shame. You know, people want to deal with it by themselves. There's child carers suffering by, looking after their parents by themselves, not saying anything, and it's affecting their grades. Because it's still taboo to talk about it or ask for help. Last night we had a discussion on dementia in the black community, which is on the rise. It's going to double in the next 25 years. That's my age group. I'm scared. All my children to be looking after me, not hiding me in a closet.
Do you know what? You're right. But this is just about mental case perspective. Self-denial and speaking out about it is important. But that mental case perspective will always be only when you are sure it is a safe space. Because Oluseni Lewis's mother wanted the best for her son. He would have, I'll show you Oluseni Lewis's picture.
But when I'm talking about speaking out, I'm talking about speaking out within our family, or within our social group, not necessarily.
He did. He told his mum, and they took him to A&E. And then within 24 hours, 15 officers restrained him. He's no longer with us. So you're right, seeking help. But the thing is, maybe it's the perspective I've come from. Because this is a fraction of what I know and see. So knowing all this, you're right. You're completely right. But unless it is a safe space, I would not recommend it.
How will we know it's safe?
No, do you know what? Go with your gut. If you feel it's safe, like if somebody said to me, somebody was unwell, and they also recommended that they go to the same place I know that this person went to, I know what I would say. I don't care if they say it's safe or not. Do you see?
Yeah,
go with your gut.
But my point is within the family, not necessarily using the services.
But you know, he told his family. He told his family, and look what happened.
But the majority of the cases I've come across, they don't want to deal with it. Like we spoke about last night, they don't want to deal with it within the family itself.
But you know what? Sometimes they don't want to deal with it in the family, and this is with all due respect. Sometimes the family can be the source of the problem. That's why I'm talking about safe space. Safe space. Sometimes, like people talk about families' rights to know certain business. Sometimes it's the immediate person within that circle that's the source of the toxicity. Not in all cases. So it's just understanding and working with people where they are. You're right to speak out about it. But I wouldn't recommend that for a melanated black-skinned person in this country, in this hour.
Scary.
I would not recommend it unless you are very old, because he would have been a PhD student. I'll show you somebody else. He didn't even want to be in the system. He asked for help. The police restrained him and he died on camera. He went into the system 3 weeks. His family didn't allow him to speak to people. He's no longer with us. They just picked him up. Hours he was gone. But so knowing all this, I can't say speak out. What would be the consequences of that? Unless you know.
It's a double-edged sword.
Sorry?
It's a double-edged sword.
Well, no, that's what that heightens the need for. Our brothers have been talking about, and our sister about, the need for us to create a safe space. Well, no matter what, the thing is, if it's talking therapies, they'll just talk you to sleep, or they'll give you a headache. You know you won't die of it. You know, like if it's in our community, no one's going to restrain you.
Yes.
But if one of the issues is that basically we don't really trust these institutions, what would it take for us to kind of start trusting these institutions? Apart, yes, obviously, from the obvious. But apart from the obvious not dying custody or etc. But what else needs to be put in place?
They're corrupt institutions.
Give her the microphone so she can.
They're corrupt institutions. I mean, the medical profession make money out of experimenting on blacks anyway, in the prison system, and in schools and in hospitals. I mean, as soon as you go into hospital, you've got no guarantee that you're going to come out the same person. You are basically a guinea pig, and that's the way they make their money. I mean, I think it goes back to slavery days, where they made money out of the population as slaves, and now that we're free, they're still making money out of people by experimenting on them. As simple as that. That is the situation we have right now with so-called mental health. Who's diagnosing? Who's doing the diagnosis?
What my sister said is when people do go in for a standard operation, if it's linked to a medical school, they have to train their students in with people. It's as simple as that. And if you're under anaesthetic, they will do whatever. Because a psychiatrist was telling me that. Because if the hospitals linked to a medical school. I'm not too sure what, but there's certain things that apparently are harmless, I've been told, that, students will come in, you're out, you're not any the wiser, and they will do whatever it is they need to do, and then lessons done, and you don't know if you're studying for 1 hour or 3 or 5.
But even in the prison system, you actually, how do you know what you're eating? How do you know what medication you're taking? I mean, the prison system is a perfect place for experimenting people. You've got no rights, you can't consent or whatever. But same with mental health. Once you're in the system, you can't say yes or no to anything. You literally lose your rights. So the real issue is not just about being mentally ill, but also having the rights as well while you're mentally ill. Say no to certain medication and what have you, because people are coming out worse than they were when they went in.
And
Or they're dying, basically.
and Norman Lamb said that at the conference in 2013, and there's a body of evidence to show that people who are detained under the Act, whatever their condition, when they come out, it's got more extreme than when they went in. There's data to show this.
Yeah, they're guinea pigs, basically.
And so, the thing is, our mandate and our raison d'etre is not about addressing fear, because some say it's founded, some people say it's totally unfounded. It's ensuring that human rights of those from the diaspora on these shores are upheld, particularly when they're in custodial settings. And so it's a very good question, but given our capacity and resources, sorry to keep on saying it, we're sort of otherwise, because it's important what you're saying, you just get stretched. And by saying that, then other people think, well, what about this, what about that, and maybe they can pick up on the other aspects.
Any other questions?
Good evening, Matilda. I just wanted to say that I think what you're doing tonight is excellent. I just want to share an experience with you. I'm a teacher by profession at secondary level. I've been a teacher now for nearly 20 years, and I've tried during my career to keep contact with a lot of my African and Caribbean pupils to support them. What's concerning me now is what I've noticed in the last 10 years is that I have a number of ex-pupils who've been diagnosed as bipolar, and I'm concerned that they're sort of giving out this diagnosis as confetti. I had an incident last year with one of my pupils that I've known since she was 11. She's now 30. Her father took her to A&E because she was displaying behaviour that was questionable. Very basically, both her parents are deaf, so they couldn't do anything for her. Thankfully, because she lives near me, sorry, I'm still in contact with her. And what I found was really important, that I made a point of going to the hospital to see her every single day while she was there. And she was there for like 3 weeks. There were two things that concerned me. The first thing was that there were a number of medical professionals, because we had a tribunal for her, that were sort of telling her things like, my ex-pupil has a daughter, and she knows that she has a daughter, whereas there was a report written saying that she thinks that she has a son. That concerned me. Also, what concerns me further is that a lot of these African and Caribbean young women are being diagnosed with bipolar or whatever. They're then being prescribed medication with a diagnosis that the medical professional is not sure about, and that just concerns me. I'm just concerned about how, you said there's a lack of knowledge in our community, and I completely agree with you. I wouldn't advise anybody to take their member of their family that's displaying obtuse behaviour to A&E, because I really believe that if myself and my other teaching colleagues hadn't visited the ward regularly, she wouldn't have managed to come out. I mean, we managed to get her a solicitor, but I'm just concerned about the high level of diagnosis of a lot of young black... Well, yeah, basically, I've noticed that because I've kept in contact with most of these girls from the age of 11, and they're now 33, and they're ringing me up and saying, oh, miss, I've just been diagnosed as having bipolar.
But they obviously need some help, so where would you direct them?
What I was trying to do for this particular... What I've been trying to do for this particular...
Yes, but where would you direct them?
Sorry. So I want to respond to your question. What I was trying to do for this particular pupil, because she was on her degree at, at Goldsmiths, I was actually trying to find her care, not within the GP system. And I was actually trying to identify an African or Caribbean therapist for her. I wasn't successful about doing that because she'd had a number of episodes prior to being sectioned in 2013. And I was aware of her mental health issues, and I was trying to sort of liaise with like you said, that the family can be a source of the problem. I think a lot of it has to do with the father of her child and the fact that her parents are both deaf and dumb, and they've been a source of anxiety for her as well. So I was trying to find her therapy outside of the system, and I wasn't successful at doing that for a variety of reasons. And she was sectioned in 2013. What I did make sure I did every day was to visit the hospital where she was sectioned, because I felt that they needed to have somebody there. Her father took her there, and he wasn't visiting her. So I made sure that every evening for 3 weeks I visited her, and I found that a lot of the staff were very hostile to me as her ex-teacher who'd known her for nearly 20 years, turning up at the ward. But I was doing that because basically I was concerned about her safety, and I wanted to keep track of her medication, and I wanted to be clear about what was happening, you know. So I don't think there's an easy solution, really.
No.
Well, the David Bennett Inquiry report highlighted the particular problem that black mothers presented when it came to their sons who were detained under the Act, because they showed far too much interest in their care and would interfere with the care plan and prescribing. So it's quite interesting you say this. These are not new things. I have to be careful with my words, because are we going to have this on for the rest of the evening? Is it on?
No, another 5 minutes, we can turn it off.
Okay.
So if you finish officially, then we can turn it off.
Okay. No, it's no. Your point is very. All I will say is that your presence there, you have no idea. You have
I
absolute.
haven't finished what I'm doing for her. Sorry to interrupt. I want to tell you something.
Okay,
You have absolutely no idea. You have absolutely no, because what you've seen this evening is not the whole picture. You have absolutely no idea what your presence is consistent. But that takes a lot, because we know the data shows that being a carer takes its toll, and that's why it's a group thing. And so your question about how do we perceive this is very important, because I'll be honest, when I found out about the David Bennett Inquiry report, I thought, not me, not me. And then when I just got the fire, and I realised this is the most important thing on the planet, it is. If this is the most important issue, and the people in the system are the most important. Some of them are the most intelligent, articulate. I'm hoping some of you will be able to attend a conference that we're holding in October on this issue, and hopefully meet somebody if he's able to speak, or do a workshop. He was in the system at 19, his parents went back to the Caribbean. You know what it's like, there's a generation who just went back. They sold their house and their children were okay. And then he actually did have some breaks down, and a revolving door patient, and his book is incredible, and it shows helicopters, police with riot shields, and this is back in the day, and I thought, what? And then, anyway, and then he was on an inpatient ward in North London, and the psychiatrist said, you are so sick, you will never live by yourself. Today, the man owned his own property, rents out property, is married, has written books, has advised government on